starting with fibrous dysplasia, and we'll cover the following topics. What actually is fibrous dysplasia? So it is a benign, self-limiting, non-encapsulated lesion. It is a developmental anomaly of bone due to defect in osteoblastic maturation and differentiation. We know that osteoblast is the cell that makes the bone. If something happens to this cell, that is, some defect happens to this cell, then obviously the bone will not be formed. Normal bone is replaced by fibrous connective tissue. That means the bone that we have, in place of that now we have fibrous connective tissue. And this is how usually a patient with fibrous dysplasia manifests. This is basically a type that is a craniofacial dysplasia. We'll learn further. So you can appreciate the swelling on the face. Now, etiology. Etiology is a defect occurs in GNAS1 gene. A mutation in this gene causes fibrous dysplasia. As of pathology, so what happens when GNAS1 gene undergoes mutation? It causes an increase in production of cyclic AMP. Cyclic AMP controls a number of factors. That is, it causes hyperfunction of endocrine gland. It causes melanocyte proliferation. Now, melanocyte is the cell that gives color to the skin. It also causes alteration in differentiation of osteoblast. So, classification. Now, fibrous dysplasia has the following types. First is the monostotic fibrous dysplasia. Second is the polyostotic fibrous dysplasia. We have varieties of polyostotic fibrous dysplasia. First is the McCune-Albright syndrome, and next is Jaffe-Lankenstein. Last we have is a craniofacial fibrous dysplasia. We also have cherubism in this classification, but we'll read this later. So these are some of the syndromes associated with fibrous dysplasia. So what actually happens in Jaffe-Lankenstein? It is associated with fibrous dysplasia plus café-au-lait spots. Café-au-lait means coffee colored spot. You can see it in the picture. These are the coffee colored spots present on the skin. McCune-Albright is associated with fibrous dysplasia plus café-au-lait plus endocrine disturbances. Mazza-Brod syndrome is where fibrous dysplasia and intramuscular myxoma is present. Clinical features. So the age is usually under 30 years and there is no sex predilection. Site for monostotic. So monostotic and polyostotic, the difference is mono means occurring in single bone and poly means involves more than one bone. Monostotic type usually occurs in maxilla. Polyostotic type involves the skull, facial bones, long bones and pelvis. The craniofacial type usually occurs in sutures. Clinical presentation. We can see a bony hamartoma, dome-shaped or nodular swelling, and the swelling will be firm and smooth. Oral manifestations. The patient will complain of tenderness, pain, swelling and deformity of jaw. Now, bulging of jaw will be the first sign. Now, individually we can study the types. Monostotic type occurs in children below 10 years of age. A single bone is involved. It is a slow growing and painless swelling. There is expansion of jaw and destruction of cortical plate. It also causes delayed eruption and displacement of teeth. The polyostotic type is found more commonly in females and the ratio is 3:1. There is gross swelling. It is painful. And we have already studied the two types, the Jaffe and McCune type. We can see Shepherd's crook deformity. So Shepherd's crook deformity, we can appreciate it here. It has occurred in a femur bone. You can see that there is a bowing of bone and it has taken the shape like a shepherd's crook. Craniofacial fibrous dysplasia is confined to a single anatomic site. Primarily, it occurs in maxilla and in sutures of skull. Radiographic features. So early lesion shows uni or multilocular radiolucency. And in later stages, we can see orange peel appearance. Now this orange peel appearance occurs because there are some spicules formation. Now spicules are basically thorns of bone. If we see it from top, we can see something like this, and this gives an orange peel appearance. There is scalloping of endosteal bone. Now scalloping is something you can understand, like it's a block and somebody has scooped out a portion from a spoon. So it forms a scallop like structure that we can see here. You can appreciate it like somebody has scooped out a portion of the bone. You can also see rind sign. Now rind sign is formed due to thick sclerotic bone formation. The rind sign can be seen here. It is a thick, can you see this? It is a thick bone formation. This is called the rind sign. We already knew that the bone is replaced by fibrous connective tissue. The bony trabeculae. This is the H&E diagram that you're going to be making. Roughly that diagram. So we can see the bony trabeculae here. These are irregular. And these appear Chinese pattern like. Now the trabeculae consist of immature non-lamellar bone. That is, the bone inside these trabeculae is immature. Next important point is that the osteoblastic rimming is absent. Usually the bony trabeculae are lined by osteoblasts, but here the rimming is absent. The osteoblastic rimming is absent. You can also see the original H&E stain. These are the trabeculae which appear Chinese pattern like, and it is also called coastline of Maine. Now there are some differential diagnosis. We have non-ossifying fibroma, aneurysmal bone cyst, adamantinoma, giant cell tumor. Before knowing the treatment, we need to know some extra points. So the monostotic variety, it can actually cause blindness and deafness due to compression of nerves, and this compression occurs because of the sclerotic bone formation which presses onto the nerves, which can cause blindness or deafness. And the polyostotic variety has high malignant potential. So the polyostotic variety can turn into an osteosarcoma. So treatment for monoostotic, the treatment we are going to give is cosmetic surgery, decompression of optic canal. We can also give vitamin D bisphosphonate. It reduces the pain and increases the osteoblastic activity.